All right, how you guys doing? This is Jay from Life RX Wellness. This is David. We're going to work a little bit on that neck, on that cervical area. And this is the great exercise, the wall angel. So go ahead, we'll do wall angel. Step 4 or 5 inches away. Well, what I'm going to do here, the wall angel is, don't do arms yet. We're working on the cervical area. And I saw people like doing that kind of exercise. You can do it, but I believe it's kind of a little bit more, I don't know, dangerous kind of. Well, let's see. So it's because the band is to go towards your face. So I put the band behind that occipital area and I stretch it. So I see the stretch it. Yeah, make sure it's attachment. You hold it very tight, okay? You not let it go. So what we're doing here, you attach it.
Yeah.
I want you to push your arms, palms up like this against the floor, and I want to start touching that head against the wall. So push it against and back. So forward, kind of tuck chin, exactly like that turkey walk. Here we go. It's just Thanksgiving, so great exercise. It's called turkey. Let's call it turkey.
For Thanksgiving?
So yeah, tuck that chin. There we go. Look at that. How hard for him, right?
Hard.
So it's hard. Now that means something is not active. We do have a bowl. What we're doing here, we place that bowl behind that head, and I want you to start squeeze that bowl. Squeeze, like push yourself against that floor, against the wall. You can do on the floor, yes. If you're older folks, if you feel it's too much for you to standing, what we're doing on the lay down position, you remove that spine gravity, that pressure. Always do exercise. If you're in pain, you want to rehab, you start on the floor with the spine in vertical, not a horizontal position. Push it, push and hold. Relax. Push again. You see, he's struggling. This face is mean. It's mean something he compensated. When people doing this,
True.
it's compensation,
Yeah.
because some others start active. Okay, let it go.
True, yeah.
Let's back to this bend again.
My thoracic.
Thoracic. Let's deep again. Hands against. Don't worry, you're fine.
Okay.
He don't like when it's pushed on his ear. Okay, palms up. You see the palms have to be face up. And pull again. And look at that. Look how easy it is now. He's touching that wall.
I've never been able to do
Exactly. He never touched that. So
that. Wow, first time ever.
we reactivate with the bands and squeeze. So always push against that. I see people like do a lot of pulling, but not pushing against. So that's what's that. Even like this exercise, if my hip uneven, I start pushing. You see, push this through that ball. I'm squeezed that. I don't want to blow that one because I have a little bit different one. This is specific for neck and stuff. Also, we continue work on that neck rotation. Push against the wall. Push. There we go. Neutral position first. So I want that neck is attached. Now I want to do this rotation left and right. I'm just watch that. Different. And look at that. You see how difficult is turn and his eye. So what we're doing here, he's turned to that first restriction barrier. I am adjust him. Boom, right there. You see how his chin was looking up.
Right.
So now he's neutral. He's done this again.
Oh, did I?
Yes, because your body is adapt everything, and he liked this position. So I want him to do this exercise. He's looking to the left, so his head is locked. He's not moving his left. Now he's looking to the left, now to the right. He's only moved his eyes. You can help him. Yes, you can help him with the finger, with the pan. So he's looking left and right, up and down. Hold that head, so he's not moving. We clear that visual now. Now look to that left and try to turn more. Did he turn more? Yes, he did turn more. You probably see on this camera, this one is more neutral. But now, what I'm going to do, I'm going to reactivate with the bands. So come up here and get that ball so comfortable. And I want him to turn and squeeze it against that ball. So squeeze. He's rotated and push. No, just push and hold. So he's kind of pushing against that ball. Try to squeeze, not to lean. I correct that.
Right, not
Squeeze, exactly. So he's rotating against that. Push. I release that. I get that band. Always, your client can adjust it. Go ahead, adjust it how you want it.
good.
It's good?
Yeah.
Okay. So what I'm doing here, I want to get that deep arm. Put the stretch, tiny stretch. I always hold. Now go ahead, do rotation. Rotate left and right. Turn.
Oh, turn right and left.
Try to adjust it to the wall. Here we go. Keep that against the wall. Push against the wall.
Oh, okay.
And rotate. Whatever you can go. Whatever you can go. Here we go. Don't try to get that in first move. Try to correct it right away in first minute. It's take days, sometimes months, sometimes even years. A little bit more. Try to look. Try to look. Don't forget to your eyes. Always follow with your eyes. You see, he's not, and he's coming up again. That's fine.
Wow.
Again.
Wow.
There we go. I'm switch side.
Amazing.
I want to reactivate muscle. I'm holding right here. You see, I'm holding his shoulder. He's rotated against the wall. Yes, please touch the wall. Thank you. Start rotated. Try to look. The muscle is slipping. The motor control problem. A little bit more, and I release that bend. Try to turn now.
Wow, so much easier.
Yeah. No, attach to the wall.
It's really much
Look
easier.
at that, and turn this way. It's 10 degrees better. Just think about it.
Wow.
In 2 minutes, yeah, it's wow. It's if you're gonna do this for 10 days, you're gonna start change your pattern. If you just did this once a month, it's not gonna change anything. So if you feel this limitation in your neck, which is you need that rotation, you want to look around, you want to see for the danger is coming up on you. So do those exercises for at least for 10 days with the bands, with the pulling, holding, standing, all those exercises we show on our channel. So stay healthy, happy Thanksgiving, have a wonderful day.